Chapter 32, Disorders of Endocrine Control, the Adrenal Gland. So the adrenal glands, which are located on the kidneys, produce about 30 some odd hormones. The major adrenal cortical hormones that we talk about for the most part are mineral corticoid or aldosterone, and the action of the aldosterone is essential in the role of potassium regulation, particularly excretion, and sodium reabsorption and water balance. It's the active mechanism in the renin-angiotensin mechanism. An additional adrenal cortical hormone is glucocorticoid or cortisol. And we know that the action of cortisol stimulates gluconeogenesis, or the formulation of glycogen from non-carbohydrate sources, and it functions in the liver. We also know that cortisol breaks down proteins and mobilizes fatty acids. It suppresses the immune response and assists with the stress response, all of which are essential for survival. Cortisol also plays a role in the inflammatory response by reducing humoral and cell-mediated immunity. And we think there's a link involved in emotional. Last but not least, the adrenal cortical hormones are considered the sex hormones, or the androgens and estrogens, and they assist also with maintenance of blood pressure and cardiovascular function. The adrenal cortical hormones are activated by secretion of ACTH from the pituitary. So the pituitary gland is involved in how adrenal cortical hormones get secreted. Just a high-level action chart of how cortisol works. Adrenal cortical disorders are usually classified in terms of insufficiency or excessive secretion or hyperplasia. So in in adrenal cortical insufficiency, it means there is an inability to make all three of the hormones. If this is a primary reason, we call this Addison's disease. It can also be due to a secondary adrenal cortical insufficiency caused by another disease process or medications, or it can take place as part of acute adrenal crisis. In excessive adrenal secretion, where there's excess glucocorticoid hormones, we call that Cushing syndrome. Or you could also have hyperaldosteronism, or too much aldosterone. We're not going to talk a lot about congenital adrenal hyperplasia. We're going to focus on Addison's disease and Cushing's disease. So here's a great picture of Addison's disease, which is adrenal hypofunction and insufficiency. It is very uncommon, and it causes decreased mineral corticoid, glucocorticoid, and androgen secretion, all three areas. It can be caused by a pituitary tumor, or most likely in a primary sense, it's an autoimmune disease. We can cause this artificially by surgical removal, or infection can cause this to happen. The signs and symptoms that we would see are related to the decrease in the hormones that are being secreted. So, hypoglycemia, a very active GI tract, so vomiting and diarrhea, hypotension, low blood pressure, potassium retention, high potassium, hypercalcemia, high calcium, hyponatremia, low sodium, muscle weakness, arrhythmias because of the differences in the potassium. In the neurosystem, we would see confusion and fatigue. We also know that signs and symptoms of adrenal crisis would be profound hypoglycemia and shock that eventually and rapidly leads to coma and death. In order to diagnose Addison's disease, we look for corticotropin levels to distinguish if it's primary, and these levels would be very high. If it's secondary, these levels would be low. So that tells us whether we're dealing with a primary adrenal gland issue or there's some other cause that we need to take care of. We would also do an ACTH stimulation test. We would expect to see elevated BUN, potassium, and calcium. We would expect to see a decrease in sodium. Cortisol levels would be decreased, particularly in the morning. I forgot to say that one of the hallmark signs and symptoms is a increased pigmentation of the skin, or a tanning effect, if you will. Now, the opposite would be Cushing syndrome. And Cushing syndrome is an excess of glucocorticoids or androgens. It is primarily a disease of the adrenal cortex. Secondarily, a hyperfunctioning of the anterior pituitary gland. And tertiary, a hypothalamus dysfunction or injury. Complications of excess cortisol are osteoporosis, which we often see in terms of pathological fractures, peptic ulcers, lipidosis, or disorders of fat metabolism, which create these fat pads that occur at the back or the buffalo hump and in the abdomen. We see impaired glucose tolerance because we have increased gluconeogenesis and insulin resistance, so much like metabolic syndrome. Signs and symptoms are hyperglycemia, slow wound healing, suppressed antibody function, hypervolemia related to sodium and water retention, so you'll see weight gain, a disturbed menstrual and sexual function, severe mood swings, the buffalo hump, and muscle wasting of the extremities. So this person becomes very round with very skinny extremities. The skin becomes thin, the hair is thinned, a moon face occurs, and lots of hair. We diagnose this by doing 24-hour urine for cortisol levels. We can use our CT, ultrasound, MRI for checking for pituitary tumors. We would also see elevated white blood cell counts. Treatment is to restore hormone balance through either surgery or medication to manage the primary reason for dysfunction.